Hello. On the occasion of Women's Day, I would like to welcome you with my fellow women oncologist, Dr. Heeba Altaf, who is a consultant in radiation oncology at Narayana. I am Dr. Nidhi Tandon and I am a consultant medical oncologist in the same hospital. As you're aware, the theme for this Women's Day is gender equity, and here we would be discussing about equity in health. Being both in the field of oncology, we would be discussing about the most common cancers in women, including breast, ovarian, and cervical cancers, and we would be talking about how to screen for these cancers and what are the early symptoms which should bring you to a doctor. So, Dr. Heeba, I would like to start with the most common cancer in women, the breast cancer. So, what are the symptoms that a lady has when she is in early stages of breast cancer?
Yes. So, breast cancer, as we know, that it is one of the most common breast cancers in India in women, and the main symptoms that the patient can present with, it can be either a small lump or a big lump. It can be dimpling of the skin, retraction of the nipple, change in the shape of breast, or in some cases the patient may present with the discharge from the nipple. So these are mostly the symptoms which are localized. Patient may even present with a lump in the armpit. So these are the patients in whom the disease may have spread to the nodes in the axilla. Now, in some patients, if the disease has already spread from the breast to some other organs, they may present with a different set of symptoms. In patients where the disease has spread to bones, patients may present with bone pain. In patients where the disease has spread to brain, patient may present as with headache, vomiting, and maybe loss of consciousness. So there is a wide spectrum of symptoms that a breast cancer can present depending upon what stage they are at. And as we already have seen that breast cancer is one of the cancers where the screening has a major role. So screening basically is where we are doing tests in an apparently healthy individual who don't have any symptoms. And the reason because in breast cancer, you can pick up these tumors at a very early stage, much before, 1 or 2 years before they actually present with symptoms. And at that stage, the treatment is mostly curative. There are very high chances of cure rates, and patient can even avoid certain modalities of treatment which may be required if they are diagnosed at a later stage.
So, as Dr. Heeba just mentioned, there is a vital role of screening in breast cancer. So, the first and the easiest modality is self-breast examination. So, every month, at almost the same time period, because we try to match with the hormone level of your menstrual cycle, the lady can examine her breast in a circular fashion and a radial fashion, going from nipple outwards. And if she feels any abnormal lump or any abnormal hardness or any abnormal dimpling, he or she can visit she can visit her physician or her gynecologist or her surgeon. The women should also be examined by a physician by a clinical breast examination almost once a year. It has been found that above the age of 50 years, there are modalities available to find out breast cancer in early stage, known as mammography. Mammography is just like an X-ray of the breast region, and it is to be done once every 2 years to detect breast cancer in early stage. So, Dr. Heeba, are there any hereditary risk factors in which the women should get screened before the age of 50 years?
So, when we talk about screening in breast cancer, we have to always see that whether the patient is an average risk or she's a high risk. Now, average risk, as Dr. Nidhi has already said, that after the age of 50, 1 or 2 yearly annual mammography should be enough. But we have to see certain women who may be at a higher risk of breast cancer. Now, these include females who have a personal history, previous history of a breast cancer, or they have a very strong family history of breast or ovarian cancer in their family. Then there are females who may have a known genetic mutation, for example, BRCA1 or BRCA2. Now, these mutations increase the incidence of breast cancer in those females. There are also females who may have been exposed to radiation at a younger age. So these small set of females are at a higher risk of developing breast cancers. Now, in those cases, we may not wait up to 50 years of age for them to get screened. They may be screened at least 10 years before their family, the age at which their family member was diagnosed as breast cancer. At least 10 years before that age, they should start screening. Even the patients who are females who have been exposed to previous radiation, they should also start screening maybe at 25 to 30 years of age. And in those cases, there may be other modalities that can be also helpful for screening. In addition to mammography, they may use ultrasonography and MRI breast. So these two modalities can also help to diagnose these breast cancers at an early stage.
So coming to the next cancer, which is common in women and is on an increasing incidence, is ovarian cancer. Ovarian cancer is the cancer of the ovary, which is where the eggs are produced for females. The problem with ovarian cancer is that it is generally asymptomatic, that it is without any symptoms in the early stage, and that is the reason why it is detected in advanced stages. When it is advanced, it may present as pain in the abdomen, swelling of the abdomen, or vomiting and constipation because of affecting the bowel, or urinary symptoms because of it compressing upon the bladder. But these all mean that the cancer is in quite advanced stage. Having said that, even in advanced stage with the combination of surgery and chemotherapy, we can still cure a lot of women, and hence we should not lose hope at diagnosis, and we should proceed with the treatment. Unfortunately, there have been multiple studies about using some blood test or ultrasonography to detect ovarian cancer at an early stage, but none of them have been proven to be useful. So unless you have a family history of breast or ovarian cancer, or you have as Dr. Heeba just mentioned, a mutation which increases the risk of breast or ovarian cancer, like BRCA1 or BRCA2, there is no need for screening for ovarian cancer, because it will not help to detect the cancer at an early stage. Which are the other cancers which are common in women?
So the other one of the second commonest cancer in women in India is the cervical cancer. Now, cervix, basically, it is the narrow and lower part of the uterus, which connects uterus to the vagina. Now, what we have seen is the cancers of the cervix, the most important and significant risk factor is an infection called HPV infection. Now, this infection can happen in many women, and it usually can get cleared over 6 months to 12 months, 6 to 12 months. But in some females, there may be this persistent infection, and these females are at a very high risk of developing these cervical cancers. Now, there can be other risk factors related to this infection, like early onset of such sexual activity, multiple sexual partners, or immunosuppression like HIV, or patients who are post-transplant. Now, these females, they may be at a higher risk of developing this cervical cancer. Having said that, we have seen that from the start of the infection for HPV to the development of the actual cancer, the duration can range from 10 to 15 years. And during that period, these cells are actually precancerous. They may not be the actual invasive cancer. So if we catch this cancer at a very early stage, at that stage, it is highly curative. and the treatment modalities are not that much invasive. So that is why, like in breast, the screening is very important. It is very important in cervix also. So, Dr. Nidhi, you can tell what are the guidelines right now for the cervical cancer.
So there is a test called a pap smear test. So it's a simple test where the doctor or the nurse will take a spatula around the vaginal region and take a slide, basic a smear, from the cervical region, and put it on a slide to be seen under the microscope. This is called a pap smear. It is completely painless apart from the pain during the internal examination, and it can detect cervical cancer at an early stage. It is recommended to be done once every 3 years. Now we have a special test called a DNA test. It is basically looking at the HPV virus, which Dr. Heeba was just talking about, and the HPV DNA test can be done once every 5 years. Instead of doing the pap smear once every 3 years, and this helps to detect the cervical cancer at an early stage. Dr. Heeba, there is a lot of talk about vaccination for cervical cancer. Can you throw some light about it?
Yes. So, as we were talking about, that HPV is a very significant risk factor for the cervical cancer, and even in HPV, there are two main strains which are at higher risk of these cervical cancers, which is 16 and 18. Now, we have over the period of years, different vaccines have been developed which can provide some protection against these cervical cancers. So there are two vaccines which usually should be given in females which are not yet sexually active, and the guidelines right now is it can be given as early as 9 years, usually less than 14, but can be given up to 26 if they have not yet been exposed to any HPV infection. So these vaccines have shown that they can reduce the incidence of cervical cancer in females, especially related to the HPV infection.
But the only thing that remains is that even the women who have taken HPV vaccine should continue to undergo screening as the other individual, though it definitely reduces the risk of getting cervical cancer.
And it is very important to know that in India, cervical cancer patients usually don't come or seek medical attention when the symptoms are very early or undergo screening. They usually will seek attention when the disease is usually advanced. And since the screening, either they don't have the proper information or awareness about it, or they are not comfortable to come to doctors. So this we lose this opportunity to treat them at a very early stage where the chances of cure are very high. So I think it's very important that these patients, as especially females, they should seek medical attention as soon as they have any of the symptoms. So most of the common symptoms if we see for cervical cancer can be in the premenopausal women, it can be postcoital bleeding or heavy bleeding between the periods, or it can be in postmenopausal, it can be postmenopausal bleeding or whitish discharge per vagina. So these symptoms, if they are continuously for more than 2 or 3 weeks, it's very important that they seek some medical attention so that these symptoms can be well evaluated and any of these cancers can be diagnosed as an early stage.
So we will like to end this session by just stating that women's health is as important as the men in your family. So you should not ignore your symptom and visit to the doctor as soon as you get any symptom, and try to get screened for breast cancer and cervical cancer, because cancers are completely curable in early stages. Thank you.
Thank you.